going to present to us with a short paper is Frances Porritt. Frances is an academic librarian, and also Hazel Wright will be presenting as well with Frances, who is the Wellbeing Services Co-ordinator at Teesside University. And their short paper is entitled, and you can see it on the screen, but I'm going to read it from my script, The Library as a Space for Wellbeing, a never-failing spring in the desert. Love that. So if you're ready, I shall switch off and let you present.
Thanks very much, Biddy. So I just wanted to start by explaining the quotation in the title of the paper, A Never-Failing Spring in the Desert, which is from Andrew Carnegie, because what we wanted to get across is that libraries have always been spaces for well-being and seen as sanctuaries, safe spaces, places to enhance knowledge, but also to contemplate and to be calm. So that's what we're trying to get across in our paper. So I'm going to pass over to Hazel now. If we can have the next slide, please.
Thanks, Fran. Good afternoon, everybody. Thank you for having me. It's a pleasure to be here today. I'm not known for being able to keep it short, but I'll do my best. So my background is in public health and sort of lifestyle advice, fitness, sport, physical activity, nutrition, etc. I've worked at the university since 2005, so a long time. And in that time, about 15 of those years, I've been a member of something called the Healthy Universities Network, which people may have heard of. If you haven't heard of it, check it out. It's the healthyuniversities.ac.uk, because that's really the stuff that I'm going to talk about now is what I've come to use as my way of working. Really, it's the stuff that I use to guide what I do. It's all about healthy settings. So basically what I'm going to do is just talk through a bit of background about healthy settings, and then I'm going to hand over to Fran after that, and she's going to talk you through some of the results and the insights that we got from the research that we've done in our library at Teesside. So basically a healthy setting is a place to spend time in where we tend to spend most of our time. So that might be work for us. It's university or college for a student. It's school if you're a sort of school age. All sorts of different settings. So the setting is the place where you spend the majority of your time. And the idea of a healthy setting is the fact that we want that place to be a place where you can nurture your health, your well-being. And it's also an opportunity for health promotion, because there's a lot of people in there, and it's an opportunity for improving population health. That's with my public health hat on. So it's got a list there of the different healthy settings, and you will find for a number of those there are guidance criteria to help those organisations, those settings work towards being a healthy setting. You've probably Healthy Schools is probably the most popular one. It has a big sort of list of ticky boxes it's got to do to actually get a badge as a healthy school. Others, for example, Healthy Universities, which is what I know most about, just has guidance. So if you look on the website, there's lots of different guidance, lots of research papers, papers from all of our network meetings, etc. Loads and loads of information there for you to have a look at if you're interested. So you'll notice there's even healthy stadia, healthy prisons, hospitals and healthcare facilities, etc. So there's if you think about what a setting it is you spend most of your time in and how you can make that a healthier place to be. Next slide, please. So that's just a definition of healthy settings. Efforts concentrated on working to make the setting itself a healthier place for people to live, work and play. The settings approach means combining healthy policies and a healthy environment with complementary education and initiatives. So it's about the whole system, if you like. You'll have heard of whole systems approaches. I'm going to talk a little bit more about that in a second, but it's about the whole organisation. It's not just the nice to have couple of activities going on that might be like about healthy promotion, about healthy eating, or an event or an activity. It's about the whole system from an organisational, strategic and operational point of view as well. Next slide, please. So a healthy university aspires to create a learning environment and an organisational culture that enhances the health, well-being and sustainability of its community and enables people to achieve their full potential. So it's about all of the people in the organisation. It's the staff, the students, any visitors, anyone that's actually coming onto the campus or is a user of that setting, even if it's remotely as well. So anybody at all. So as it says there, it's a whole university, or otherwise known as a whole system approach. So these terms get used interchangeably. So the setting approach, basically, if I say that, I'm meaning healthy university or whole system approach. Then it also later on in the presentation gets called a place-based approach, which is again something you might actually have heard of. These are all terms that get used interchangeably nowadays. So it combines high visibility health related projects with system level organisational development and change, and that balances that with multi-stakeholder engagement, with high level commitment and leadership, and driven by higher education and public health agendas. So it involves public health and higher education and other partners obviously working together. So next slide, please. So just a few sort of things that Healthy University Approach aims to do. It develops an ethos and environment that supports health and well-being. It values the views, skills and experience of the whole university community. It increases participation and builds collaborative partnerships. It leads to sustainable changes to improve health of students and staff. And it draws on best practice related to organisation development, learning and change. Next slide, please. It also provides a framework that goes beyond the intervention. So just what I said a couple of minutes ago about it not just being about a few activities or interventions that you might do. That tends to happen quite a lot, where you end up with sort of single topic, single population groups, and only focusing on individual parts of the system. So therefore it recognises interconnectedness, interrelationships, interdependencies and integration between these topics. So for example, food and mental health is one example, obviously in cross-population groups and elements. It understands universities as part of a greater whole, embedded in local and global communities and interacting with the wider environment. So again, it has an element of sustainability along with health in there. So it's looking at the whole system. And is a mechanism for delivering against strategic objectives, which I'm sure will interest everybody, because we're all measured on a lot of different things nowadays to do with retention, student experience, performance, etc., etc. Next slide, please. So this is an example of healthy universities in practice. So a project that we had a few years ago now, we worked with our local authority public health partners and a number of other larger settings in Middlesbrough. The public health team came up with the PLACE acronym. They amalgamated the criteria from healthy universities, health promoting hospitals and healthy colleges, and they came up with the PLACE acronym. And it's basically encompasses what I've been talking about a whole system or a healthy setting approach. And then the 5 letters of PLACE mean process, leadership, activities, connected, and environment. So hopefully that kind of gives you a good image to sort of identify how the idea of place actually is encompassed by all of those things rather than just one or the other or bits and pieces of each of those. So there's a visual on there and obviously people can take a good look at that later on. So next slide, please. So I just had a little bit of a Google when I was putting my presentation together to see what examples I could find of libraries as a place to support and nurture wellbeing. So we've got things like workshops, we've got yoga in the library, some places do things like that. We've got wellbeing spaces. We've already heard that obviously there's a lot of reading for pleasure and the benefits of that ourselves. We have a reading group. We've also had creative writing groups. We've had poetry sessions, you know, that sort of thing. There's a guidance there from the Scottish Libraries about how to improve wellbeing through your library. We've got there about autism friendly spaces or times. So there's lots of different examples of how libraries can be a space, and Fran already alluded to some of that in her little introduction at the start. So next slide, please. So something that is of great interest to me and has become a bigger interest over the years is this idea of designing for health and well-being, and looking at the built and the designed environment, and how that can actually have an effect on how it can benefit our well-being. And there's a term that I came across not that long ago called neuroaesthetics, which I think was coined in about the 1990s, so it wasn't that long ago. And it's basically about, these are just a couple of quotes from a couple of papers that I found. It says, today the field has evolved beyond its initial scope with a growing body of evidence demonstrating the direct impact of the visual arts, architecture, design, digital media and music on the human brain, biology and behaviour. So it's really wide ranging. It is so interesting how your environment and all of those things within that environment can actually have an effect on your overall well-being. And the second paper there, employing neuroaesthetic principles is more radical than putting a few potted plants and some warm, cool coloured walls into a traditionally drab mental health facility. It's a deliberate rethinking of institutional spaces whose dark corridors and dead ends reinforce their bleakness. So that's about a mental health facility. And there is quite a lot of research on mental health facilities and what they can actually do to them. So it's really, it's about this idea of place and what we can do with that place. From a design perspective, things like the colours, the furniture, the way the furniture is configured, the way the spaces are configured, but also the things that we do in there. So the places, the spaces, the objects, the things that are actually in those spaces. So next slide, please. So again, I don't know if anyone's heard of Healthy Happy Places, the Academic Science Health Network. They're Northeast based, and I attend quite a lot of their webinars. So I would encourage people to, if you're interested in this sort of thing. And their vision is to develop a concept for a sustainable innovation hub in the Northeast and North Cumbria for the creation of healthy, happy environments through collaborations between health, public health. So again, it's that healthy setting approach, working health, public health, education, etc. together. But importantly, the built environment professionals who are quite difficult sometimes to engage with in sort of the health and well-being world sometimes. So that's why this is so exciting and so interesting, because it is really innovative what they're doing. And obviously the third sector and communities that can be supported through innovative financing mechanisms, such again probably shared funding for projects which would enable investment in new and existing places. So I attended this webinar, just one webinar actually, they do quite a few, just last week, and it was on creativity and well-being. And there was lots of different examples of projects and places that had been specifically designed to support different health topics such as dementia, Parkinson's, all of that sort of thing. And also something that's being talked about a lot now is, as it was mentioned at the start, is this sense of fostering a sense of belonging and connectedness. Through the design and through the activities that you do, but also through taking this whole system approach. And we found in our findings, I won't spoil Fran's bit, but we found in our research that there wasn't as kind of a need for, or people asking about ways in which they could connect. But even the fact that they were just in the environment without actually speaking to other people, they still felt connected and part of something, which was really interesting. And that's something that we're starting to work on a lot more around. How can we enable people to be or feel more connected and therefore feel a better sense of belonging, which will help their overall health and well-being and their time at university, basically. And I think an interesting question for me is to how to foster well-being for our different student populations as well, from maybe a cultural point of view. And something we're really keen to do is to work on some co-creation with students, with our different populations of spaces and activities as a result of the research, which is obviously still ongoing, but Fran's going to talk to you now about a few of the findings. So I'll hand over to Fran.
Thanks, Hazel. Now the next slide, please. So we have a library wellbeing group. I know it's probably quite common in lots of universities. We consider both staff and student wellbeing, and our initiatives to date, some of which Hazel mentioned, such as creative writing for wellbeing and the reading group, are open to both students and staff, and we like that, so that students and staff can be on a level. We have members who were also in the Academic Libraries North Mental Health and Wellbeing group. So that's me and a couple of others, but Hazel's also very active in lots of groups that she's mentioned as well. So if we could move on to the next slide. So we decided to gather some data on what our students thought of the library as a space for wellbeing. So we conducted the research early May, and we're going to do more of that. So I'll touch upon that later. We've done a variety of different methods of data collection. So we've done some observations at different times of day and night. So there was myself and Hazel, but also there was 2 other members of staff who are wellbeing responders, and they came in at 2 in the morning and just to do some observations of what it was like as an environment at that point. We did an online questionnaire and also had some printed copies available, and we got the best response when we were had a kind of stall and we were handing out fruit to students. But Hazel has for many years has made fruit available for students during exam periods, so as a way to nourish students. We also conducted a focus group with students. So we contacted participants who had completed the questionnaire and asked them if they would be interested. And we were very mindful that it was quite a critical time of year as well, that it was an exam period, lots of assessments being due, but students still wanted to be involved with the focus group because they felt that they had something to say. They wanted to be part of the discussion. And also the students were aware that there's going to be some refurbishment in our library, so they're having an input into that. We also conducted a brief individual interview with overnight security, because we have outsourced security staff on a night time between 8 in the evening and 8 in the morning. And then we also, and within the questionnaire, there was questions about the environment itself, how students feel in the library, so how they felt at that point in time, whether they felt stressed or other factors had come into play. We also asked about different aspects of the services and a potential new service, which is to potentially provide some family-friendly study sessions. And the questionnaire was a combination of open and closed questions. So if I could have the next slide, please. So I've just very quickly picked out some of the key findings. There's a lot more to say upon this, but obviously we don't have time. So what we found is that the length of the visit can be very lengthy. And one student in the focus group had said her kind of maximum period had been 24 hours in one sitting without leaving the library at all, which was a surprise to me, because myself as a student, I would have never studied for that long in one go. But this is quite common, it would appear. So we did ask questions about how long they stayed, and this wasn't unusual, the 24-hour. And there's also myth and legend about students who actually live in the library as well. So as we said, we asked students how they felt in the library as a space, and we gave them lots of options of their emotions that they were feeling. And the majority of students said that they felt calm and happy. And we were so pleased about that, that the fact that despite it being a high intensity time of the year, and despite it being a very, very busy environment, that students did feel calm and happy. We do have, it's an area that we don't have kind of floors that are separated off. So it's a very open environment in the library. So we've tried to provide zones for students, so that we have individual study, silent study, group study areas. But what we found during certain periods, because it's so busy, that they don't work particularly as intended, which is unfortunate, but just as a result of the environment itself, the way that it's been designed. We also asked students about if they felt that they belonged to a library community. And very pleasingly, again, quite a high percentage of students felt that they did belong to a community. Other issues that came up was about cleanliness, and this was particularly in the context of being post-COVID, when there'd been lots of restrictions in place, even though, you know, the library was open during the period, but, you know, you'll be familiar with the kind of restrictions, but people still see this as a very key issue, and so very concerned about cleanliness. We are a 24/7 library, so again, it was the availability of refreshments during the whole period when the library is open. So during the times when the library cafe is closed, we do have vending machines, but there was still felt to be a need for there be further refreshments. And noise is very clearly an issue, and I'm sure it is in lots of academic libraries particularly. But it's an impact, it has a huge impact on students' ability to concentrate and feel calm. So that's another aspect that was very key in both the focus groups and in the questionnaire responses. And we asked students how often they visited, and lots of the students visited daily. If I could have the next slide, please. So I just picked out a couple of quotes from some of the open questions. So students who were feeling that they came at night because it was calmer at night, and this was quite common as well, that the library during the kind of peak hours, the about 10 till 5, 10 till 6, very, very, very busy in there. So students are choosing to come to study at night time because there's less busyness and less activity. So if we can just move on. So we do have lots of different kinds of study areas within the library. We try to provide to every, all right, we've got 1 minute off, blimey. Right, so students liking to be able to sit in a private space so that they can get on with their work and concentrate more clearly. If I can just move on, because the next quote, I really like this one, because it was saying that it was kind of their top space outside of their home, and I think that's, you know, really, really encouraging that we've managed to create that despite the busyness and so on, that it's still a very, very much a favourite place for students. And if I could just move on. So what we're going to do is going to repeat the survey at other times of the year, because it changes depending on the time of the academic year. We're going to do focus groups with front of house staff, but also repeat focus groups with students, and repeat interviews, and try to do some more individual interviews so that we can ask more in-depth questions as well. So I think this is part of an ongoing piece of research which will be much fuller, and we will find out more as we go along. So I will stop there if there's any questions.
Thank you very much, Fran and Hazel. That was really interesting. I'm going to see Susie, do you want to be in charge of questions? Are you?
Sure, we have quite a few, so I will start with the first one and work through, and if we run out of time, maybe Fran and Hazel, if you're happy to share your contact details in the chat, people can contact you direct if we don't manage to squeeze your question in. Yeah. So the first question we have is, what would a family-friendly study period look like? I think that was a question maybe for Fran. So, well, actually, it might be better to go to Hazel, because Hazel was involved with the discussion with, so there was some academic staff involved as well. I'll pass you back to Hazel if that's okay.
Yeah, it's fine, Fran. So we're looking at, because the ground floor of the library is about to be refurbished, we're looking at how we can use part of that space to provide a space where there's opportunity for students who have younger children at the moment to be able to have some time to study, but if they have nowhere to look after the children, it's not going to be a creche. It's just going to be a space, and we've been researching sort of different options for what the space might look like. So the children wouldn't necessarily be in a separate space, and while the students go off in the library, it might all be in the same space, but there'll be provision for the students to study and activities for the children to do while they're studying. There's quite a lot of planning still to do for it, so it could look a little bit different to that, but also we're looking at maybe some more guided activities or more sort of specifically delivered activities for the children at different times over the course of time. So at the minute, it's probably only going to be looking at like a few hours a week. We're going to try it as a pilot, and then we're going to develop it from there, do some and obviously, like I said in my bit about sort of co-creating the spaces and the way that we do things with the students, so we do what is, you know, what they want and what they need, really, rather than just us doing it and expecting them to kind of get on with it.
Yeah, that leads into another question quite nicely, Hazel, actually, about ideas, interest about how you're thinking about working with students about co-creation, because co-creation is talked about as a kind of a trendy thing, but we're interested in like what it actually means.
So for this one, we've got some, like Fran just mentioned there, we've got some of the early years students who are hopefully going to be actually doing some of the facilitation for us. We've already been meeting with the academics that teach those students, and we're going to bring some of the students in to actually plan what it's going to look like, and then also these focus groups and future kind of focus groups on that particular activity. We'll bring them in, the students who are going to be using the services as well, to talk to them about, you know, what that might look like and what they actually need. We did allude to it a little bit in the focus group that we did, but it obviously it needs quite a fair amount more input from the students now. But it's about involving the students in the whole process, rather than just bringing them in maybe when you think you might, or not just asking them for their IDs on a post-it, but actually having them write in from the very, very start of the whole process, so that they get to actually create the environment that they're actually going to be using.
That's really useful, Hazel. There are loads more questions, but we need to be moving on to our next person. So maybe Hazel and Fran, if you can look in the chat and maybe between you kind of answer some of the questions that have come up there, that'd be really helpful.